We move on to the next session, which is the session on is your trainee on track? And I thought Apurva's case fit in well with this theme as well. So it was a good segue. Our panelists will be, of course, Dr. Helena, Dr. Padma Malani, Dr. Rolika is here, and Pranesh, Dr. Prashant Garg, and Dr. Deepak Mishra. See here, I think he must be on his way. So in the interest of a little, to make sure that we do hear Dr. Prashant on time, he has a flight a little later in the evening. So we'll have his talk first, which is 360-degree evaluation of your trainee. And once, I think we can have a small discussion after his talk, and then we move on to the rest. उनका ये सेशन में थर्ड टॉक.
Okay, it's seen here, it's not seen on the screen. Okay, so thank you. Good afternoon, everyone, and I really want to thank Akshay for accommodating my request. The objectives of this talk will be to talk about why 360-degree assessment is important, to give you idea about how we conduct a 360-degree assessment, what are the key competencies that are typically evaluated as part of 360-degree, and how can we implement it in our setup. I think let me give you some case scenario. We are all aware of our residents or fellows who do very well in theoretical exams. They always will score very high. And if you look at those scores only, you will feel he or she must be a very bright candidate. The question is that how successful that tool is as an assessment is one of the questions that I have. Similarly, we have seen in a classroom there are candidates who just keep on raising hand, replying all the questions. Again, probably a trait that we consider that a resident is very good. Third is the residents who present themselves very well. They are not only well dressed, they have all the soft skills that are required to be a good doctor, and in the morning session we learned some of those soft skills. But are all these traits indicative of that a resident or a fellow will be a good doctor or clinician? Let us look at the case of a resident who was kind of extremely well behaved, very well groomed. But if you talk to the nurse will say he never comes on call when he is on call. And your phone is always switched off, we have to call repeatedly. Let us look at the scenario of the boy who kept on raising hand, answering all the questions, and you find that the colleagues complaining that he or she is rude, never allow us to speak, and he shouts at other colleagues of the. Third, a candidate who scored very well, and we have seen that in practice, that they are not so polite with the patients. Many times they do not even attend to the basic questions and the basic issues that they should be attending. Many times we struggle with such fellows not doing pre-operative rounds or not answering the queries of the patient. Now, if we all look around, these situations are not uncommon. When you feel that a candidate is doing very well, but if you take feedback from others, you find that they are not. And therefore, I think one of the traits that is important for all of us to realize as a clinicians is that the clinical outcomes and the quality of clinical care does not entirely depends upon physician's performance. It also depends on how well you coordinate and collaborate with all other team members, right from how you behave with your front desk staff, to counselors, to your nursing assistant, to patient care staff. Everybody is part of the overall experience that patient gain. and your physician's quality alone are not the determining factor. Number two, that physician's knowledge is playing only small part. In clinical medicine, there are many other attributes that give comfort to our patient. How involved we feel with the well-being of the patient. And the words that, no, we will do our level best can make a whole lot of difference in the lives of people who are suffering with critical. So some of the competency domains that are very, very crucial in healthcare are mutual respect and shared values, understanding the roles and responsibilities of other professionals, communicate in a manner that supports the team approach, and truly a teamwork, which is involving relationship building, values, and principles. And therefore, you will all realize that our assessment of one time on their knowledge cannot provide a complete assessment of how good a clinician is. 360-degree assessment is a measurement tool completed by multiple people in an individual's sphere of influence. That is a typical definition of 360-degree assessment. And these assess competencies as well as behavior rather than the knowledge and personality. So it is important that those people are now going to give you feedback on the competencies. Now, what are the competencies that we need to assess? Besides knowledge base and skill proficiencies, on which we have talked a lot in the past 3 hours, we also need to know professionalism. We need to understand the ethical behavior. We also need to know about their capability as a team personnel as well as interpersonal skill, communication skills, and the use of information technology, because now information technology is playing another important role. It should also give you information about how good he or she is in facilitating learning of other team members. Now but the 3 important traits that are particularly crucial are the professionalism, team player or interpersonal skills, and the communication skills. So how do we implement these 360-degree assessment? The step 1 is, let us all be convinced about that 360-degree assessment provide you much wider overview of the trainee rather than their knowledge base alone. You need to decide and get buying in from other members, because if they are not made part of that decision, they may do shoddy job while they are providing you feedback on their performance of the training. So you should call all the members who are going to be part of 360-degree assessment and assess whether they are buying in on that idea or not. You should develop and adopt the existing tools that are already available. Some of these are published by the Ophthalmology Foundation. This is one tool that we published in Canadian Journal of Ophthalmology, how we conduct the 360-degree assessment. Interpersonal skill and communication skill, the attributes that you are going to be evaluating are effective communication with the patient and family, effective and respectful communication with the members of healthcare team, and use of effective listening skills, because they are the key attributes. And the question can be, resident communicates effectively while maintaining appropriate boundaries with the patient and families. Resident explains timely and effectively the process and course of action to the team. And resident elicit history using effective questioning and takes time and effort to explain the disease and intervention that are going to be on the patient. So there are other components also which we published in that journal. Now here, once you have identified what are the attributes, you can put questions in a manner that the responder is able to answer on a grid of 0 to 1, or agree, slightly agree, neutral, slightly disagree or strongly disagree. Ultimately, you want to get insight from them on various traits that are listed here. Now, it is also important to educate all the stakeholders, because if you do not educate the stakeholder, again you will face the problem. We in LV Prasad Eye Institute once decided to carry out without educating stakeholder. And based on their own personal experience, without using any matrix, they have started giving 5 out of 5. And when we asked question as to what are the questions that you asked resident, they said, no, I didn't talk to the resident. What are the attributes that you looked into? No, he does very well. So what I'm saying is that the whole purpose of 360-degree assessment is lost unless you educate them. These are the attributes, these are the behaviors which are expected, and these are the behaviors which are unexpected. Now you use this on a grid to identify whether the resident has or demonstrate those attributes or not. Stakeholders, you will have to take faculty members, administrative staff, fellow resident, medical student. So all the people who are going to be in the sphere of the concerned person have to be made part of the stakeholders. You should also inculcate team training, make the residents and fellows or the program such that there is a sense that healthcare is a team effort, not an individual effort, and you should have some courses where other members of the team are also part of it. So to conclude, while most of the assessments are done based on the knowledge base of a candidate, I think effective patient management is beyond that, and there are various other attributes that also we need to assess. And the 360-degree feedback is to ensure that we are looking at all other attributes so that ultimately the clinical care provided to a patient is of a desired standard. Thank you very much for your time.
I'm aware this is done routinely in LV Prasad, is what I
We did that.
okay. Anybody else has experience with implementing 360-degree? Dr. Helena, do you want to comment? Anybody else? And what, or for experienced educators, say like Dr. Patmal, what do you think is the success you will of implementing, or what are the barriers to implementing a 360-degree evaluation? What is your take? I mean, it's a big training center, Narayana Netralaya. So what is your take?
We have independent modules, each one takes care of each aspects. So now everything put together to form the circle, which we need to do that.
So, I think when I joined my fellowship, we had a system that even my reports were given to Dr. Rao at that point of time by nurse in charge, by the what you call as a senior fellows, as well as my colleagues, the front desk staff and the operating nurse. And yes, and that's how actually I learned
Full
that.
thing.
So yes, it was not very structured on particularly but later on we brought that structure that you have to look at following trait. But he put that system long ago where he will say, is the fellow coming to the ward in the night for pre and post-op rounds? How is his behavior? Does he speak well? How he speaks to the patient and how he speaks to all of you. So these were the questions that he used to ask to every member of the team. And then only he used to give that assessment to us. And that he used that criteria to decide who is going to be faculty in his team or not.
So that's Dr. Rao. Right? What do you think, Akshay?
I think a couple of points. As residents, we may not necessarily get the opportunity to do a 360-degree assessment before enrollment. But I remember as fellows that used to happen. There was in LVP, of course, residents are allotted through the nationwide NEET, but fellows are interviewed and there's an MCQ, a multiple choice question exam that is like a screening, and then you go into an interview, which is the subject interview with faculty. And then there's a third interview with people who are not at all of the faculty. I remember that time Dr. GC, yourself, and Dr. Dr Prashant Das discussed absolutely abstract things, and what are you doing? How was your experience at this in your residency? What did you do different there? And what are your goals and plans? So I think in some way that was kind of a screening to see, is this guy going to fit in, or at least does he fit in with the expected goals and the visions of the institute? So
Yeah, but that is, I still will say that's a part of the 360 degree, because we are looking at other attributes of a selection as a fellow. But when you are there undergoing training, participating in different activities, if you take feedback from the different groups who are working with you, you get very good idea about what are the other attributes other than the knowledge that a candidate demonstrate while delivering clinical care. And that is more important.
When he asked you about residency, I hope you said good things.
No, and even about residency, since we're talking about flipped classroom, while we're doing a 360 assessment of the trainee, when Dr. Meenakshi was the academic director, she did a flipped 360 degree assessment of the trainers. So each trainee who would be posted with, each resident would be posted with a consultant for a month, had a rubric which included interpersonal skills, discussion with the patient, teaching, surgical skills, and exactly how you would have of the resident for the teacher, for the trainee, for the consultant, which would be confidentially, we had to come and give it to her in the back. So
No,
I think it works both ways.
360 degree feedback is not just for resident. It works other way around also, because you are playing role of being educator when you are educating, and therefore feedback from them has to come.
Yes, Dr. Akshay said for DNBs, we don't have, they come through the counseling. This applies to the fellows in the interview board, in addition to the mark sheets and other things, like from the HR team, the emotional assessment quotient is also assessed by the common person, and then they have an induction course. Behavior and other things have been taught to them by the administrative staff, and there the behavior is assessed not only by the consultant, the front desk, and the patient's feedback. All this is analyzed, and when they change the posting from one person to the others, everything is assessment to both, as well as the theory, the clinical aspects, and then the feedback is given, and then they change the postings.
Well, from the trainee point of view, I'll just add one point. We're kind of aware that everybody is observing us. Like, you know, I one day was told by Dr. Hunawar that you're supposed to do this particular surgery. And I'm like, how do you trust me? Because you've never seen my surgeries. And that's the day when I realized that, no, he has technically seen my surgeries through everybody else. And somewhere it does give you a sense of fulfillment. It's like a tick mark. Okay, check mark. Okay, fine. Okay, it's a confidence level check that, okay, I'm doing something right, that's why this is being handed over to me. So from a trainee's point of view, the 360 degree assessment helps us also to build confidence further.
Thank you, Dr. Prashant.